course you know her from Buffy and even Gossip Girl, but Michelle Trachtenberg began her successful acting career at the age of 3. She booked over 100 commercials before making her television debut on an episode of Law & Order. Throughout her childhood and adult life, she consistently booked jobs. It was even rumored that she was ready to return to TV on the revival of Buffy the Vampire Slayer. Sadly, in late February 2025, she was found unresponsive inside of her apartment and was later pronounced dead. Michelle did not have a full autopsy examination performed, though the coroner did conduct a few tests to obtain her cause of death. I want to make it clear that I do not have her medical records and am simply using my medical knowledge to help shed more light on what these results can mean and hopefully help put some rumors to bed. I have watched many people jump to unflattering conclusions that really began a year prior to her death. In early 2024, I began seeing TikTok after TikTok displaying Michelle's thin appearance while creators expressed concern for her well-being. It seemed that the most common assumption made in the comments was substance abuse. These assumptions took on a life of their own after she was found deceased. The coroner performed a toxicology report and external examination while also using medical records to arrive at the conclusion that she died of complications of diabetes mellitus. Diabetes mellitus is basically an umbrella term for the different subtypes of diabetes, and hers specifically was adult-onset diabetes, also known as type 2. The toxicology tests were able to exclude that any type of substance contributed to her death. We also know that Michelle had undergone a liver transplant sometime in the year prior to her death. Diabetes is a common comorbidity seen with liver disease. Sometimes diabetes can increase the risk of fatty deposits and scarring on the liver that can lead to failure. Other times, a different illness results in liver failure and a diabetes diagnosis comes after transplant. Pre-existing conditions coupled with the trauma of surgery and harsh after-therapies can result in post-transplant diabetes mellitus. Diabetes can be difficult to control, especially initially after onset. It's a delicate process of tweaking the diet, testing levels multiple times a day, and introducing the proper dosage of medical therapies to try and keep levels in the sweet spot. Additional illness, medications, and trauma on the body can directly impact whether treatment is successful. As long as it is not, there can be long-standing damage done to the body and its processes needed for life. For instance, if glucose levels remain too high, it can cause irreversible damage to the vascular system, more specifically blood vessels. This opens the door to a range of both localized and systemic complications. It's the transport of oxygen-rich blood that keeps our vital organs running, and without it, they will fail. Another complication is called diabetic ketoacidosis. This happens when your body is not receiving enough insulin. It triggers a catastrophic reaction where your body quickly breaks down fat to use as an energy source. Once processed through the liver, it is converted into ketones, which can be harmless, but at this volume, it builds up in the blood, causing it to become acidic. This can lead to coma or death without prompt medical attention. We will never know exactly what went wrong for Michelle, but we do know that she had zero fault in her death. It's highly likely that she was battling multiple complications and illnesses, and it tragically claimed her life. Over 100,000 people die from diabetes complications per year in the US alone. It's an issue that deserves far more resources, recognition, and education.